A lot of women in this age category, myself included, grew up in this time where it was skinny equals healthy. And so that's changed dramatically, I hope, now, whereas it's all about strong is healthy, which I think is a wonderful change. But it's hard to sort of let go of that whole idea of skinny is healthy when you've grown up, being taught that your entire life.
Hello and welcome back to the show. All my perimenopausal ladies dealing with fatigue, funky bowels, and bloating, listen up. This one is for you. So the menopause transition, also known as perimenopause, can bring along a whole slew of symptoms, several of which can involve digestive issues like bloating and constipation. Today, we'll help you understand what this phase of life entails and why it may bring about changes in digestive health and gut symptoms. We will also talk about why IBS is more common in women and the link to hormonal fluctuations. We'll chat about how those of you dealing with IBS symptoms during the menopause transition can best support this transition through diet, lifestyle, and supplement changes. And we'll also touch on hormone replacement therapy, or HRT. Now, let me share a little bit about our guest today. This episode has been in the works for a while, and I'm super pumped to be joined by Nicole Dynan, who is the founder and director of The Gut Health Dietitian in Australia. And she's recognized as one of Australia's leading dietitians in gut and hormonal health for women in midlife. Having navigated her own health challenges, Nicole is passionate about helping women understand how the gut influences everything from bloating and weight changes to mood, energy, and overall well-being. Outside of her work, Nicole loves running, which I can get behind, as well as yoga and tending to her edible garden. Let's dive in. Hello, Nicole. Welcome to the show today. So I'm super excited. I know we've had this episode in the works for a little while, but very excited to have you on and share your expertise in gut health and the connection to hormones and the perimenopause transition, because I know this is a really important topic and probably one that's not talked about enough. So super pumped to have you on the show today.
Hi, Lee. Thanks so much for having me. I really appreciate you getting me on all the way from Australia.
Yeah, I'm glad we could find a time that worked for both of us. Always tricky. Yeah, so just to get started, I'd love for you to tell us more about who you are, who you help, more about your educational background, and then what really got you into wanting to work with women in midlife who are experiencing digestive issues and wanting to support their gut health.
Yeah, sure thing. So I'm an accredited practicing dietitian, which otherwise known as a registered dietitian, I think, in Canada. But I'm in Sydney, Australia. I'm a mum of two children. I have worked in gut health now for over 12 years, and I've got a team of dietitians, and together we've supported over 40,000 clients. Yeah, so we've been busy. We have a corporate practice as well, so we do get to reach and help a lot more people via those channels. But prior to that, I haven't always worked in nutrition. I did retrain mid-career because I spent many years in chronic disease management within the pharmaceutical industry. And I got to the point that whilst I absolutely loved that work and I loved the people I was working with, I did feel like I was putting a Band-Aid on the problem of chronic disease, that these people would come in and then, we would train the doctors up on different medicines and the doctors would then prescribe the medicines. And all the time I'm thinking to myself, but hang on a sec, like there's got to be something we can do before this time to actually help people avoid going on the medication in the first place. Yeah, so that really, I guess, encouraged me to go back and do some further studies. So I went to the University of Sydney, which was my university first time round, did my master's in nutrition and dietetics and became a dietitian. So today, really, I work with a lot of those similar women over the age of 35, often in perimenopause and menopause, just helping them optimize their gut health so they can avoid going down that path of chronic disease, but at the same time, just giving them confidence in their bodies so they can transition through that life phase a little bit better than they would otherwise.
Awesome. That's really interesting. I didn't know that dietetics was your second career. So it's cool to know, I guess, like a lot of health practitioners, reason we go into this is we want to help people be more preventative, proactive about their health. And usually share the same general idea about medications, is that it's like it can be helpful time and place, but it's, you know, not something we want to start with. But I think it's cool that you actually like worked in that directly and, you know, saw it happen firsthand and realized that it's something that you want to, you know, I guess change in a sense, or be more proactive about what people can do to support their health, and not always necessarily need to jump into taking a medication. So that's really interesting.
Yeah, absolutely. And I agree. I just feel so grateful that I actually had that experience first up, because I think it helps me not only know what medications apply to different disease states, so that was super helpful, but also just have that sort of understanding of the path that people travel through their health journey as well.
Mm-hmm. Awesome. So, getting into our topic today, perimenopause, or the menopause transition, as you know, brings along like a whole slew of different symptoms, quite a long list, which can also overlap with other conditions, but some of them being digestive related. So, bloating, constipation. For those listening and watching, can you explain a bit more about what the menopause transition actually is? And then what's the link to gut health and digestive function with hormone fluctuations?
Yeah, sure thing. The perimenopause transition is that sort of 4 to 10 years leading into menopause. So, menopause, by definition, is that one day where you haven't had a menstrual period for 12 months. And then it's called postmenopause, interestingly. But I think a lot of times, you know, menopause and postmenopause are used interchangeably because it just makes it easier. But that perimenopausal time, 4 to 10 years, it can vary just depending on the individual. I think it's probably one of the most unstable hormonal times in a woman's life, because estrogen and progesterone aren't just, you know, being friendly and just gradually and slowly declining. You can just have fluctuations in that declining period as well. So it's often called the zone of chaos for that reason. But in saying that, I'm so grateful that we're talking about it a lot more these days, because in my experience, many women don't even realize they're going through perimenopause, because it can start, you know, as early as 35 years of age. And so, you know, you just put things like bloating or constipation or reflux or poor sleep or just even feeling more anxious or stressed just down to life and, you know, work and maybe having a family or aging parents or whatever's going on. And then all of a sudden their period stops, and then the penny drops. Oh, actually, I've been going through perimenopause for the last 4 to 10 years or whatever it is. So I think in terms of the digestive symptoms, they can often be an early clue that things are starting to change, because I think, you know, often we're associating hot flashes with menopause, or perimenopause, but they often come later, sort of more towards the latter end of perimenopause, whereas those early symptoms are a little bit more vague and so extensive. Like, women experience things like itchy ears, for example, like, you know, you just wouldn't necessarily put that down to changes in hormones. But the estrogen and progesterone receptors are all along the digestive tract. And so when hormone levels start to change, the digestion can be one of those early clues, as I said. And then obviously with the gut brain connection, stress just heightens that as well. So it becomes more likely that all of this is going hand in hand during this time. So there was 4 key things I thought we could potentially touch on, if you're happy for me to jump into those.
Yeah, for sure.
In terms of like how the gut influences hormones.
Mhm.
Yeah.
Yeah.
So the first one is just with the microbiome diversity. So really, I think this one underpins everything, because lower estrogen is associated with reduced bacterial diversity in the gut. So particularly as we get sort of more into that postmenopausal phase, it really becomes more obvious that the diversity of the microbes in our gut are changing, and that can
Can I just
influence.
ask, is that due to there just being lower estrogen that influences the gut microbiota? Or
Um,
is it?
Yes, part of, obviously, as we age as well, I think the diversity, when we look at those diversity graphs, it sort of is low diversity, when we're babies, then gradually over time, the immune system is trained and we build up more diversity, and then peak diversity sort of in midlife, and then sort of starts to change again as we get older. Yeah, so estrogen has some part to play in that as well, but it does influence things like inflammation control, because one of the other symptoms in this time is like joint aches and pains and things like that, and obviously metabolic health. Our gut's linked to metabolic health, etc. So whilst we do need more research in this area, it's really fascinating to sort of make that connection, I think, with that microbiome diversity and how things change with our hormones. Mm-hmm. One of the big focuses I have with women in clinic is obviously focusing on trying to keep that diversity as much as possible. The second one is the gut lining integrity. So we've got this protective layer of mucus in the gut, and so estrogen's really supportive of that lining. And as our levels drop, then the lining can become more permeable, more sensitive, and that can contribute to things like the bloating, the reflux, the low-grade inflammation as well. The third thing is the immune function. So 70% of immune cells are located along the digestive tract. And so women, I think, with estrogen, they have more resilience in their immune system than men. So this is why I think man flu is quite an interesting term. I don't know if you've heard of that before.
Oh, yes. Use that.
Oh, yeah. But the interesting thing is, as our estrogen drops, that changes our immune resilience as well. So our gut microbiome becomes more similar to that of men. And so, which is really unfortunate, because I think this can be part of the reason why some women experience, things like thrush more frequently during this transition as well. Microbiome's changing and our immune system is impacted. Mm-hmm. And then the last one is gut motility, which is kind of really the area, I guess, you're in with the bloating and the constipation and whatnot. Just similar to what happens, when we have our menstrual cycle and progesterone influencing gut movement, those levels are falling, and so our gut movement or motility can really slow down, which is part of the reason that we can feel more bloated. Food just takes longer to digest. We can feel uncomfortable. And it's also sitting in the digestive tract for longer. So the gut microbes are harvesting more energy from, that load as well, if you like. So bloating, constipation and all of that can be just really a key problem at this time that we really try to help focus on with women to get that moving again.
Mm-hmm. Okay. So 4 different ways that it may be influencing things. And I think your point about stress was good to bring up too, because a lot of times when women go through the perimenopause transition, it's also when they're maybe, raising children, and then also dealing with, a heightened career, and then a lot of times like caregiver roles as well. So there's oftentimes I guess a lot more stress just overall, but in some ways maybe, other factors to blame, I would say, for the symptoms. Or sometimes it can be brushed off, just, you have all these things going on, so it's probably just stress. But as you mentioned, it just might be, there may also be those hormonal fluctuations and perimenopause starting at that time as well.
Yeah, the perfect storm.
It can be pretty rough.
Yes, it can be. I think, it's obviously different for different women, but there's a lot going on at that life stage for most women, I think.
Yeah, definitely. And I know IBS, so irritable bowel syndrome, is considered to be more common in women. And as you mentioned, symptoms can be heightened around the menstrual cycle, for, premenopausal women as well, just because of the hormonal changes. To your knowledge, is there any link between IBS and perimenopause? I'd love to get your take on that.
So I think, as you alluded to, it is more common in women for starters, but there is some early research in this area as well. And, just obviously many women notice more symptoms at this time. What the early research has shown is that hormones don't necessarily cause IBS, but estrogen and progesterone can influence all of those things that are happening at that time. So like the gut motility, the pain sensitivity, the immune activation, the gut-brain axis as well. So, yeah, I think it's possibly understudied, as women are in general, but clinically it is a time, I think, when women do experience more of these symptoms and unpredictable patterns in IBS as well.
Okay, interesting. Cool. And what would you say in terms of someone listening or watching as well, if they're wanting to maybe navigate this transition a lot more successfully, what would you say are maybe kind of the key changes or things to consider? And we could talk about it in terms of like three main pillars. So diet, nutrition, which is our forte, obviously, lifestyle, and then potentially if you think there's any supplements that are evidence-based that could play an important role as well.
Yeah, I love how you've broken it down into those three areas, because that's exactly the three areas we sort of focus on as well. And I like to think about it like a pyramid or a cake. So if you think about the bottom layer, like the foundation being diet, I feel like this is the part we could really focus on to make the biggest impact for women, just to fill out the cake. So that dietary part is a foundation, lifestyle would be the middle, and then the supplements or HRT would be the icing on top of the cake. So in terms of diet, in my practice, in my experience, what I see is most women already eat well, like they're really trying hard to eat well, but what they're finding is the issue is not that they're not eating well, but what they've done in the past doesn't work the same way anymore. Yeah, because of the hormonal changes. And I think too, like a lot of women in this age category, myself included, grew up in this time where, it was skinny equals healthy. And so that's changed dramatically, I hope, now, whereas it's all about strong is healthy, which I think is a wonderful change. But it's hard to sort of let go of that whole idea of skinny is healthy when you've grown up, being taught that your entire life. And so oftentimes like women will first of all lean towards restriction. So if they're noticing that they're starting to get some weight gain around the middle, the first thing they'll do is think, well, what am I going to cut out? And so they'll try everything, cutting things out to almost like they're living on a lettuce leaf, and there's nothing left, and it's still not having the desired effect.
And you mean like types of food as well as calorie restriction?
Yeah, exactly that futile focus on calories. So we're really trying to reframe everything to be more around the idea of what we can include rather than exclude from the diet. And that, I think, really becomes critical because it reframes your whole brain. It's not that you're just looking after yourself anymore, you're also nourishing your gut microbes. And I think if we can really focus on that little inner community that we've got to nourish to support us in the best way possible, that really changes the way that we think about what we eat. So that's, I think, part of it. And then I think consistency is another thing. So consistency, particularly in the dietary pattern you choose, because the gut microbiome loves consistency. If you're skipping breakfast one day and then you're missing lunch another, or you're having a massive breakfast one day with lots of fibre, but then you don't have any other fibre throughout the whole day, yeah, it can just be a recipe for bloating and constipation at the bare minimum, and probably other problems as well. But there's some research that has shown that dietary patterns like, say, a Mediterranean-style diet that's rich in fibre, legumes and oily fish has been associated with a later menopause, bring that on, and fewer symptoms. And in fact, a study out of the UK that looked at 35,000 women actually found that those eating oily fish daily experienced menopause around 3 years later. And those that had, oily fish daily, menopause 3 years later, I would take that. And those with higher legume intake delayed their menopause onset by about 12 months.
Okay.
Whereas those having like a refined carbohydrate diet actually had menopause about 12 months earlier than the average. So it can be really powerful. It's probably linked to the estrogen, which is the group of bacteria that help us manage estrogen levels in our body. Because when they're more diverse and well fed, they basically support healthier estrogen metabolism. So I think diet's a really foundational piece that we can have a big impact on.
Interesting. Okay, I didn't know that one about the oily fish, so that's good to know.
Yep.
But I might be making a anchovy pasta for dinner. So.
Yes, definitely a good idea. So that's the diet. In terms of lifestyle, that middle layer of the pyramid or the cake, I think, obviously everyone's into strength these days, but I feel like when women are getting started, I think walking is really underrated. Like it's a really powerful way, especially after meals, to be able to support insulin sensitivity, which changes at that time. Should I explain that a little bit, or do you think most people are familiar with insulin?
You know what? I think a refresher would be helpful. Yeah.
So I often think of insulin like a key, and I think it's like the key that unlocks the cell to let the energy into the cell. But then I think of it in perimenopause and menopause, and it's like the key is sort of jiggling in the lock, and it's struggling to open the cell to let the energy in. And so what happens is it just dumps that energy and stores it. And so therefore we get this increased weight around the middle. And so that's why I really encourage my clients at this stage of life to take a walk. It doesn't have to be like a HIIT workout or anything. Just, even a 10-minute walk after meals just to help insulin deal with that influx of new energy can really be supportive of managing weight at this time, and also just gut motility and bloating and things like that. So that would be a key lifestyle factor. And then, of course, the strength training to support muscle maintenance. So your muscles are like the log you put on the fire to keep your metabolism burning. So that's why we want to keep muscle. Plus, it also helps us maintain mobility as we get older, and it also helps with our bones because we want to keep strong, healthy bones as well. So they need to be supported well with good muscle mass. Yeah, so all of that and sleep, of course, I think is just makes everything better. Good sleep.
Any condition, I don't think there's a condition that wouldn't benefit from more sleep.
No, exactly. Yeah. So that would be another one we focus on. And of course, social connection, because I think I always refer back to the blue zones or those populations that do tend to have really long, healthy lives. And one thing they all have in common is that strong social connection. So I think really focusing on that at this time of life is important as well as it is, I guess, at any time.
Yeah, definitely.
And then the last thing that you mentioned was supplements. So I think about those as the icing on the cake. So I think sometimes it's flipped for people. They'll start with to think about what can I take to resolve this because I just need to get it solved. But it's really something I think that's a supportive tool as opposed to the foundation. So things like, psyllium husk or partially hydrolyzed guar gum is another good fiber type supplement that can support women, particularly if they're suffering bloating. So that could be something that might be helpful if they're struggling to get enough fiber into their diet. Probiotics are something that I get asked about a lot, and I think they can play a role in IBS, as you would know, I guess, but it's very strain specific.
Yeah.
So I think that's the biggest issue we face with probiotics, is that they often come in like, this one's got 100 strains, this one's got like all of these different strains that might actually be competing with each other.
Mm-hmm.
And therefore the benefit might not be as good as what it was if it was just that particular strain. So I think we've still got a long way to go in that respect.
Mm-hmm.
And then other supplements like omega-3, if people don't like oily fish, we would recommend algal oil, because obviously the fish themselves get the omega-3 from the algae. Or vitamin D, I think, is another one. If you're not getting a lot of sun exposure, and even calcium for bone health as well, just to sort of speak to their doctor about that, because there are some limitations on calcium supplementation. But we often recommend just having a blood test if people are worried. Check your levels and then decide what to do from there with the help of a health professional.
Mm-hmm. Okay, interesting. Yeah, I want to circle back to two things. The first one is the exercise component.
Yeah.
So I think there's been more information, I guess it's more talked about in the last like even 2-3 years around what type of exercise and the split that perimenopausal and postmenopausal women should be doing.
Yeah.
So you hear a lot about like the heavy resistance training. You need to be lifting heavy weights, and then also doing those like short, intense, like sprint type sessions. And then I think it's been thrown around that, zone 2 or that easy cardio is not good for women of this age stage, because it may work against them. So I think for people who are listening, in a sense, it can be empowering, but it can also kind of be maybe a little bit like overwhelming when they feel like, well, I like to do this type of exercise, or I like to run, but is running easy bad for me? Or going on a like long bike ride, is that bad for me? And I should be doing this other stuff. So do you have any thoughts on that, or anything that you chat about with your clients in terms of just exercise and not getting overwhelmed with all the information, which is helpful, but sometimes a little bit too much?
Yeah, it can be overwhelming, can't it? And I totally appreciate that, even from a personal standpoint. And just to, put it out there, obviously I'm not an exercise expert, but from what I have read and the clients I've spoken with, I think strength is important, but I think that for women, it's sometimes overwhelming even to get started, because they hear, you've got to lift heavy. And so then they go to the gym and they try to do that, then they get injured, and then they're set back, for another 6 months until they recover, or whatever it takes.
Mm-hmm.
And so my take on it is that you've got to start where you're at. So, you may ultimately have the goal that you want to be lifting heavy weights, but it's a little bit like training for a marathon. You just don't go out and run a marathon on day one. Like, you have to actually build up to that. So we try to take the pressure off and get them doing that, even once, twice a week to start with, build that up with the repetitions, get some support with an exercise physiologist, somebody that's trained that can really help you learn how to do it in a way where you're not going to get injured, because everything's changing. A lot of women have this frozen shoulder situation going on. Yeah, so that's another wonderful side effect that some women experience. And so it just limits movement, and estrogen packs all that joint motility and movement as well. And so things don't move the way that they used to move. So you just have to work with the body where it's at. So I think that is important, obviously, for bone, muscle maintenance, mobility, all that sort of stuff. But there's no race to the end either. So working up to that. And yeah, like, I think the running side of things, like for me, for example, like, I've always been a runner, so running's easy for me at this lifetime stage. But if you've never run, it might be difficult. And I would honestly say, like, I've probably tapered it back a bit, and I do a lot more walks as well, interspersed now, just to try and change the heart rate also. Yeah, so a bit of a mix.
I guess even I know plyometrics is something too that's been recommended for bone health, and helping with that. But a lot of times too, in perimenopause or postmenopausal, we see more I guess, pelvic floor dysfunction. So weak pelvic floor. So a lot of times women are maybe afraid of leaking or accidents with jumping type exercise. So lots to consider. We actually, I'll defer back to another episode we had with Courtney Pollock, who's an accredited exercise physiologist, also from Australia. So we talked a bit about that and how to build up safely. But I guess just to round this point out is that you don't have to go out and start lifting heavy deadlifts like tomorrow. If you're not at that point yet, then building up very slowly. And if you have access to one, maybe working with a exercise physiologist or a personal trainer who has a lot of experience working with women like you to build more safely so that you don't get injured and you're able to be consistent, like you said.
Yeah, exactly. Yeah. And I think sometimes it's just even hard to get started for women. So I always sort of try to get them to think about, like, okay, in a year's time, if you keep doing what you're doing, how will you feel at the end of the year? Trying to get them really putting themselves in that position versus if you start and gradually build up, even if you're only lifting 2 kilo weights, by the end of the year, how will you feel? So trying to get them to look at their future self and really help them move through that stage of change as well with behavior.
Yeah, that's a great point as well. And then circling back to supplements, do you have any thoughts on, I guess we'll call them like adaptogens? So ashwagandha, holy basil, anything within that category that you see as valuable?
Well, I would love to see it as valuable, but I haven't yet read anything that would convince me that it's a worthwhile thing to do. Yeah, I can't say that the evidence that I've personally read would support going down that path as yet. So, obviously it's up to the individual. I always come back to that. If they find benefit in trying it and using it, great. But everything I do has to be backed by science, as I guess the same for you. So, I haven't seen any science that would suggest that it's something that's going to have a market effect at this point.
Yeah, I guess not directly. In perimenopause, I haven't seen anything for ashwagandha. I know it can be helpful. There's some studies for more stress management and anxiety, which, as you mentioned, that can occur in that life stage. But I think based on the things we talked about, it's kind of like a tippy top protocol. We want to make sure you got the diet nailed down, you're sleeping well, exercising, and then if those things aren't working as optimally as you want, then maybe a supplement. But
and of course, always just keep your doctor, your GP in the loop for whatever you want to try, because I think sometimes some of those supplements can have interactions, not saying that one does in particular, but some of them can interact with other medications that people are taking. So I just think it's good that one health professional at least is across everything that you're doing, rather than just randomly, putting things in and hoping that you'll stumble across something that's the magic elixir.
Yeah, absolutely. That's a great point. I think a lot of people see stuff in the natural food store and they pick it up off the shelf and they think, oh, it's just a natural health product. It's fine. But they don't realize that some, definitely can contraindicate with different medications or health conditions. So it's always best to check with your GP and if possible, your pharmacist as well. Good point. Speaking of medications and pharmaceuticals, I guess they would fall into this category, but what are your thoughts on HRT or hormone replacement therapy?
Yeah, well, obviously, it's a medical decision, but I think the evidence now is very supportive of women taking it if they can. And it's certainly, from my knowledge, gold standard for things like hot flushes and night sweats. So if they are problematic, that's certainly good. But even beyond symptoms, I think there's now some evidence for the longer term health support, cardiovascular health, bone health, etc. So where we fit, I think, as dietitians is that we often have more time with clients to be able to discuss everything that's going on. In Australia, GP visits can be 5 minutes, maybe 15 minutes, whereas we'll often take an hour with a client. And so we can really try to understand like the full picture. And sometimes it's just a matter of referring them back to their GP if, they're still suffering quite a lot and might just need a dose adjustment or something like that. But yeah, I think it's certainly, I'm personally grateful that it's now back on the table compared to like my mother's generation who all had HRT pulled away from them. So I think it's certainly one to talk to your medical professional about, but I personally am supportive of it.
Yeah. And are there any considerations, I guess, just with even getting used to taking one and potentially experiencing like digestive symptoms or an increase in symptoms before it gets better? Or
I think in that regard, with digestive symptoms, there is some emerging research to suggest that it could have a positive impact on the microbiome. But I think it's really early days and it's really small studies. So really, I think where it fits mostly is to improve the general symptoms, the hot flashes and things like that at this stage. But we just need a lot more research in this area, which I believe is starting to happen. So I'm keenly watching this space.
Yeah, that would be interesting to find out. Cool. All right. Well, I think we went through quite a bit of valuable information here. I guess anything that we didn't cover, any final thoughts, or anything you want to add for those tuning in?
I think the final thing I would say is HRT is amazing if you can take it or you choose to take it, but it's not going to be a panacea. Like it's not going to solve all of your problems. So if you remember the pyramid or the cake and you just remember it as a supportive tool that you have available to you on top of that pyramid or cake, or the cherry on the top, then it's really still, I think, really empowering for women to be able to work on some of those foundational areas, which is why I think gut health is such a no-brainer in this space, to be able to help women to support their gut health, because we know the gut-brain axis exists. We know the gut hormone axis exists, the gut metabolism axis. So we can support all of those things like brain fog and mood and gut changes and blood sugar levels and weight around the middle. So all of those things we can definitely have an impact on just by working on nutrition to support our gut microbiome. So I think it's a really empowering way for women to think that they've actually got some control over this time of life, which feels like sometimes it's quite out of control. So I'd probably leave you with that for today.
Awesome. No, I completely agree. Last thing I want your take on is, do you recommend people do any sort of gut microbiome testing at home? Or I'd love to hear your thoughts on that, just as a fellow gut health dietitian.
So it is a great question, and I'm glad you asked, because I think a lot of people ask that. They really want to know. So my position on gut microbiome testing is that it is new and evolving. I don't think we're there yet from the point of view that we still haven't uncovered everything that's in the microbiome and its function. And so it's really hard for us to say that test what's in there and it'll give you all the answers. We haven't yet really translated what these microbes mean as to this is what you should eat to feed them, from the point of view of specific microbes. And even some microbes, you and I may have the same microbe, but it may do a completely different function for each of us. So I think it's great that there's lots of movement in this area, but I think at this stage it's just for interest's sake. It's not something that I would say is, you get your result and it's prescriptive of what you need to do. I don't think we're there yet. So if you want to save your money, I would probably spend it on something else at this time.
Yeah, I completely agree. I think we just don't know. There just isn't the studies to show, okay, this is low, then, do this protocol, take this or eat this food. There's just not enough research to kind of support the use of these tests to be, a clinical tool. So I agree too. I think if you have the money to blow and you're interested and you're curious, sure.
Yeah.
But if not, it's probably better to put that money towards better groceries or
Exactly.
cooking skills or other tools that have more evidence behind them. So
Yeah.
yeah, it's good to hear your thoughts because people are always thinking that anytime we talk about gut, supporting our gut microbiome health, making it healthier, people always want to know, well, is there a test I can do? How do I know if it's healthier? But yeah,
it's a good question, because obviously we want to try and measure whatever we can to see a before and after effect. But it's, I think, give it a few more years and it may have progressed to the point where it is a more useful tool that we can utilize.
Yeah, absolutely. Awesome. All right. Well, thank you so much for sharing your expertise. I think, as I mentioned, we went through a lot of valuable information, and I'm sure that those tuning in are, took away some tidbits that are definitely inspiring. And as you mentioned, empowering of how they can have more control over this life stage. And it's not just something that, we have to deal with. For those tuning in, can you share just what's the best way to learn more from you and potentially get in touch?
Thank you. I would probably say Instagram would be one of the best places. And so that's, my handle is at the.guthealthdietitian, or otherwise website guthealthdietitian.com.
Awesome. You picked a great username.
I don't know how I got that. I was very lucky.
Yeah. To the point. Awesome.
Early into the piece when it first was all happening. Yeah.
Well, thank you so much, Nicole. And for anyone listening, if you do have any questions, thoughts, you can leave them as a comment below and we will get back to you. And be sure, if you found this episode helpful, to leave us a rating and a review. Just helps, push out the episode to more people who are navigating perimenopause and dealing with gut issues to see this and have access to more credible evidence-based information. So, all right. Well, thank you so much, Nicole. Have a great day.
Thanks so much, Lee. You too. Bye for now.